Good morning. My name is Brian Wheeler, Director of Communications for the City of Charlottesville. Welcome to Cville360, a program to inform and engage the Charlottesville community. During the coronavirus pandemic, the city's leadership knows you want to hear from us frequently about our actions. We also want to hear from you and provide opportunities for engagement. We've launched this program on our streaming sites, Comcast Channel 10, and on a companion Zoom webinar, so you can tune in live and on demand while practicing social distancing. The webinar allows you to join the broadcast and ask questions of our guest. If you want to try the webinar, visit charlottesville.org/Zoom for the registration information. A link to each show appears at the bottom of the page. At the top of each show, we will have a brief update on the state of the coronavirus and the city's response from the city's fire chief, Andrew Baxter, who joins us today via webinar. After the chief's update, the remainder of the program will focus today on balancing community health with community safety. In the studio, we'll have Police Chief RaShall Brackney, and via webinar, the city's Commonwealth Attorney, Joe Platania. Whether you are the media or a community member, you can type your question in the Q&A module of the webinar, or you can click the raise your hand icon, and I will bring you onto the program to speak directly to our guest. So let's start off by just showing everyone all our participants. Make sure that we can still see and hear them. Chief Baxter, can you hear us?
Yes, sir.
Great. Well, let's bring you full center here. And before you give an update on the community's response to the coronavirus, first let me just check in and see how you're doing and how is your department staff doing at this 1 month anniversary since our first case in Virginia.
Well, we've come a long way. It's a different world now than it was even 30 days ago. Last night, I did my first ever teleconference ceremony. We had one of our firefighters complete his probationary year, and that's a big deal in the fire service. And so his shift presented him with his new leather shield for his firefighting helmet. And in the interest of social distancing, I attended by Zoom meeting from home. So it was important, I think, for me to be there, but also important to demonstrate by example the importance of social distancing. The only downside was that I did not get any cake when the ceremony was over.
And what do you want to tell the community about where we are right now with our response?
Well, I'll start where I always do with our strategic goals, and those have not changed. As a city, we're committed to providing essential services. We're working very hard to identify and protect and support all of our vulnerable populations, and also protecting and supporting anyone who's providing essential services to the community right now. Obviously, our first response community, police, fire, and EMS, are partners with the Charlottesville Mobile Rescue Squad, but also other providers that are out in the community, social services, human services, our CAT drivers, public works employees, utilities employees, NDS inspectors, and others, making sure that they have the tools that they need and the policy and the procedure in place to do the best that we can to protect them in this very dynamic environment. And then also that fourth goal that we always talk about and really drives a lot of our focus is doing what we can as a community to flatten the curve, to sustain the health system from the impact of this pandemic. I can give you an update on case numbers. Right now, we currently have 17 known cases in the city, 50 in Albemarle County, and then within the Thomas Jefferson Health District, we're at 95. And this data, it's important to understand, it includes patients that were diagnosed with a COVID-19 test or who've been clinically diagnosed, meaning they are showing the classic signs and symptoms of COVID-19 disease, and they're known to have had close contact with someone who was tested as diagnosed. So a family member, for example, someone cohabitating. You may notice in the community a little bit of a discrepancy among the data in the last day or two. VDH is transitioning to a different tracking system, and our own health district was transitioning between epidemiologists, but we're pushing out the data that we get from the Thomas Jefferson Health District. One other data note to point out to the community We, along with many other people, have been following two models in particular, one from the University of Washington and then one from the University of Pennsylvania, looking at peak dates by state. And in looking at Virginia's data, just a few days ago, the peak was projected to be in roughly the third week of May, the 20th to the 24th of May. Based on some adjusted inputs and some more real-time data, that peak estimated number of COVID cases in the state has now been moved back to April 20th, or forward to April 20th, I should say. So I'm not sure whether that's a good thing or not. It just depends on whether our capacity is there to be able to handle it. It looks like it will be now, but that really remains a moving target. I would suggest, however, that is a good indication of the impact of disciplined social distancing on flattening this curve. So we will continue to watch that data.
Thank you. Excuse me. Thank you, Chief. We're going to talk to Chief Brackney in the police department in just a minute, but I wonder if you could talk about your call volumes and what is that looking like for fire and EMS?
Well, overall, the 911 system call volume remains low. We're about 37% total 911 call volume month to month, year over year, 2020 compared to 2019 for the month of March. So that's all call types. And specifically in EMS, which obviously we're taking a close look at, we're down about 23-24% month over month. We're just coming up on 1 week in April, and we'll be able to compare that to the first week in April last year at the end of today and have a good sense. The other thing we're really trying to keep a close eye on is acuity. So it's not just the number of incidents that we respond to, it's are we seeing sicker people, and do we think it's related to the infectious disease that we're tracking and dealing with? And it's a little too soon to know whether that's occurring. Anecdotally, it does seem to be occurring, but we'll want to rely on a more granular analysis of the data in the coming days. We do know for a fact that in terms of incident call types, that breathing problem is the number one EMS dispatch call type, and that's consistent over the last 3 to 4 weeks.
David. So in the audience, if you have a question for Chief Baxter, you can raise your hand or you can type a question into the Q&A module, and I'll be happy to ask it. We're going to ask Chief Baxter to stay with us in case you do have a question for him. But right now, the remainder of today's program is going to focus on the impact of the coronavirus on, excuse me, I'm reading notes from the last show. We're going to focus on balancing community health and public safety. And so in the studio, we have Police Chief RaShall Brackney, and via webinar, we have the city's Commonwealth Attorney, Joe Platania. I'd like our guests to start out by just sharing some high-level observations to kick this off. And Chief Brackney, let's start with you. How are you doing? How's your department doing at this 1 month anniversary?
So as we mark the events of 1 month ago, when literally our lives have been changed and things have been turned upside down, not only for Charlottesville, but for the region and the nation, it's important to now understand that we are no longer policing in a manner that we used to police before. Our teams are tired, and they're tired based on there's everyday stress, but then you compound that with the stressor of, is there a possibility of exposures when you're out there doing your everyday job and then taking that exposure home to your family? Because we don't have the opportunity in public safety or in our CAT or any of these other mission critical positions to socially distance. That's not an opportunity that we have. Currently, it is impacting. We have 3 officers who are now in self-isolation due to potential exposures. Family members have been diagnosed, as well as community persons who have been out and about in the community who said they're waiting for their diagnosis but have engaged the public safety infrastructure. So that is a challenge. We have additional challenges, much like Chief Baxter. Next week, we're going to have to swear in our officers virtually, one at a time, to be able to swear them in so that we practice safe and social distancing and how do we manage that now? These are huge ceremonies when you're sworn as a police officer in the state, and we'll be able to do some more celebratory things when it's safer to do so, but we all now have to do business very differently, and we need the community to help with that co-production of public safety. And you'll hear me use that word a lot, or that phrase a lot, so that we can balance our community health with our community public safety.
Excellent. Well, let's bring Joe Platania on via the webinar. And Joe, can you hear us?
Yes.
Joe, how has this been changing your business, and how is your team doing?
We're fine, and I'd just like to give a huge shout out to Chief Baxter, his team, Chief Brackney, her team, all the first responders and the folks that Chief Baxter mentioned that are really out there on the front lines. I'm hopeful that the community that's listening and tuning in has a real appreciation for what these folks are doing on the front lines. Two sort of, I don't know if they're high level thoughts, but maybe more macro level thoughts than micro. I remember almost 2 years ago, we were faced with, as a community, the August 12th 1 year anniversary situation in 2018. And I remember about 6 months before that, sitting down, I probably wasn't talking to Chief Baxter, I was probably listening to him. And you know, we did go through as a community, not that this is anything like it, but we did go through a bit of a stress test on our community and our response systems. And, you know, we just took the view back then that relationships were the key to getting us through it. And I'd like to think that for the public that's listening, I'd like to think that those investments in relationships are hopefully paying off to keep this community safe and healthy. And I'll just close with this, Brian. I was reading in the newspaper a quote from a judge in California, and I think it captures it well. He said, "At this point, we're truly at a point with no guidance in either history, law, or precedent, and to say that there is no playbook is a gross understatement of the situation." And so I think that's sort of what we're all grappling with and dealing with, and we've got some really wonderful people locally that are doing a great job. So thanks to Chief Baxter and Chief Brackney and all the others that are out there.
Thank you, Joe. And to get our webinar audience thinking about questions, there are 5 topics that I hope we can cover today. First, perspective on the daily work of your departments. 2, the governor's stay-at-home orders. 3, vulnerable populations in our jails and the community. Number 4, examining the impacts of the coronavirus through a race and equity lens. And number 5, social distancing advice for interactions with police. So if you're interested in any of those topics or something else, please feel free to go ahead and type your question in the webinar Q&A or raise your hand, and I'll bring you on to the webinar and you can ask your question directly. First, let's just start here with Chief Brackney. I mean, you touched on a few things that have changed, but in the past 2 weeks, what can you tell us about any trends in crime and with people staying at home?
So our call volume is down. It's down about 40% in terms of the number of calls, but the types of calls that we're seeing now and intensity in are trending towards an uptick in violence. We're a lot more shots fired calls and shooting calls than we've had previously. And last weekend, in particularly Thursday, Friday, and Saturday, just the entire weekend of shots fired and individuals who had been injured as a result of those shootings. So there's an uptick in those types of calls.
And what do you attribute that to?
There can be a lot of things that you think about. If you think about everyday stressors, and then add that to tensions in close proximity that people have with each other, and then not having or a perceived option to have a healthy release to their anger, their stress, or their other valves. I'm not condoning violence at all, but I can see that there may be a stress-related component to this when people are giving into their more basic our base instincts that they may have had a bit more control over previously.
And on that front, I think it's interesting, the mental health situation, and that resources may not be available to the community that they were previously, that they had access to.
That's right. And if you see across the nation, there is a call for clinical mental health counselors, behavioral specialists, different types of therapists. There's now a call for that, as well as for medical doctors and medical professionals. If you now have to do your drug or alcohol addiction in a way that you've never interacted before, you're used to group therapy, and now you're trying to set up telemed services. How do you do that if you don't have internet, if you don't have access to the public libraries where you would previously go to use computers, or to your local coffee shop, or the free Wi-Fi that may have existed throughout the community? There really are some workarounds that we have to look at for disadvantaged populations.
So clearly your officers are still having to go out and respond to these types of calls. And what kind of risk does that pose for our public safety officers?
So there are a lot of risks that we have when we do that. There's the personal risk. As we know, and we've heard across the nation, there is a shortage of personal protective equipment, PPE, language we've probably never used so frequently before. They cannot socially distance when there is someone involved in a domestic. And how do you separate individuals and keep individuals safe under those conditions? How do you interview a sexual assault suspect via teleconferencing when there's that desire for there to be a human connectedness? How do you process a scene where there may be blood or other types of fluids, bodily fluids, that are exposing the officers? So our burn rate, or the rate in which we go through this personal protective equipment, spikes, and there won't be the opportunity to recover those supplies because you're in competition with the federal supplies, with the state, and with every other community who is continuing to have police, fire, EMS, CAT services, public transportation, as well as your mail services. There are a lot of services that are on the uptick now and who need those resources. And as we know, based on the federal response, that this is going to be a localized response. It's going to have to be, we all participate in this together so that we can all get out of this sooner and with a healthier response, with less damage to our economies, to our individual personnel, and to our mental health and our psyches.
And I just want to encourage Chief Baxter or Joe Platania, if you have any comments, you can feel free to jump in, and I'll bring your video up on the screen. Let's talk about the vulnerable populations in the community, and maybe start with Joe Platania. You issued a joint statement on March 17th with your counterpart in Albemarle County, Jim Hingley. Can you tell us what you agreed to do and why you thought it was important to fight the pandemic?
So we knew, just from a common sense standpoint, that as soon as this was starting to hit, that we needed to be paying attention to folks that were incarcerated in our local jail. Just to be clear, the Albemarle-Charlottesville Regional Jail, which is out on Avon Street Extended, houses individuals that are from Nelson County, the County of Albemarle, and the City of Charlottesville. Those are folks that are still pending state proceedings that our office and the County of Albemarle and the County of Nelson are dealing with. That's different than prisons and the Department of Corrections. Those are statewide, and those are folks that have already been sentenced. So we're talking about a smaller population locally that are still pending state proceedings. So I think it was Monday, March 16th. And again, it goes back to the concept of having established relationships with people where we know each other, we've communicated over a number of years, we've developed trust with each other. So I reached out to Martin Coomer. I won't speak for Jim Hingley, but he did pretty much the same thing, and talked to him about we need to sort of get ahead of this before it hits and we're playing catch up. So we sort of developed a plan in consultation with, different detectives or police officers that had cases that had information, the defense bar, judges, clerks, and looked at targeted and calculated release of individuals. And what we did, the first wave, there were identified folks that were at an increased health risk should this be introduced into the jail population. And we utilized something called home electronic incarceration, which is basically an ankle monitor with GPS where the jail can track somebody, drug screen them, know where they're at in real time, and they're still in the custody of the jail. So if there's a violation, they can be picked up and brought back to jail, which we, are hopeful doesn't happen. But we released a cohort of folks that were identified by the jail superintendent as medically compromised, and we then started going through and trying to identify who we felt were low risk in terms of violence. And again, it was calculated risk decisions that we were making. It wasn't that they shouldn't have been there. It was just, well, in light of what's going on in a worldwide pandemic, can we make a calculated risk decision to release? And there were several individuals involved in those decisions, and they were all judicially reviewed. I don't have the numbers, but I think that we were able to reduce the jail population by close to 100 between Charlottesville and Albemarle. Superintendent Coomer would have those numbers, but we felt like we did a pretty good job of trying to get them set up. And maybe Chief Baxter, Chief Brackney can speak about sort of the technical aspect of this, but our understanding was it's certainly removing people and decreasing the population, but it freed up facilities at the jail for isolation and quarantine and made it easier for them to not sort of be overburdened with a greater number of people. It created some space for them should they need it.
Chief Brackney, anything you want to add on that initiative?
So we were very supportive of it. There is I trust the superintendent as well as our Commonwealth attorney to make those decisions that are looking at the overall health and safety of the community. We talk a lot about balancing public safety with access and convenience, and it is something that we are aligned with, that we had vulnerable populations that if we had the opportunity to decrease vulnerability, you cannot socially isolate in prison. You just can't, and they don't have the facilities for it. And is it the humane thing to do when you have someone pending an outcome or pending a hearing, especially if it's a nonviolent offender, and then you have a way to continue to monitor them? So we have those very intentional and thoughtful conversations. And we also looked at, from the detective standpoints, how might this impact their cases as well as the community? So although we have a pandemic that is lasting or may last for the next 6 to 10 months, what does that case look like going forward a year from now? And how would that impact the community long term? So we are taking a very long-term approach to all of this. And is this the right thing to do as well, so that we don't become our prisons or our jails in this case become a hotbed for coronavirus? And if you think about it, us having to continue to transport individuals to the jail puts our officers and our public safety personnel at risk. If there's another way that we can do that keeps everyone safe, we're definitely looking to be part of the solution.
You bring up that point about how you transport people, and I remember early on during this past month a decision the department made about how to transport people who needed to be detained, and you switched away from patrol cars into a specific other vehicle. And tell us why you did that.
So very early on, I had the benefit of working with some amazing national figures. So a close confidant of mine is right now is Chief Carmen Best. She is the chief in Seattle, Washington, where they got hit first with this. So I made contact with her to say, I realize, based on everything that we're hearing through science, that this is going to be a pandemic and it's coming our way. What are those things that you put in place early on to help with your officers to keep them safe? And we went through a list of things that we could do at a very high level to keep our officers safe. So we switched immediately to one van only that would be doing transports to the jail. But we also wanted to make sure that if we had vulnerable populations like those persons who were in a mental health crisis or our juveniles, we designated a car or a vehicle versus putting them in a wagon. So we had 2 actually vehicles that we did for that. We switched to online reporting for a vast number of calls. And we also switched to telephone reporting units where you can call an officer and report if you need to talk to an individual, a particular type of crime. And we gave an entire list of those type of things that you can now call in or submit online that there was not that opportunity to do so before. It also allows then for you to get the expertise of a police officer, guaranteeing that your call is recorded, but keeping everyone safe. And we are now, we've also instituted, if we have to go to calls, you may see us in personal protective equipment. You may be asked to step outside your home so that we are not entering into a space where we don't know if there's been exposures and things of that nature. And we've had to work with our ECC or our 911 through screening calls, where they can now screen calls and ask those very real and intentional questions that keep our firefighters, I hope I'm saying that right, Baxter. I always say it wrong. Our fighting personnel, our medical responders, our health and human services personnel,
Sure.
our police personnel, and our utilities workers who have to go inside the homes. So we've made some very drastic changes based on experts in the field, and we did it very early to a lot of criticism in this community, but we're seeing that it's those type of drastic steps that you're willing to take early that will help flatten the curve, as well as hopefully stop the spread.
Chief Baxter, is there anything you'd like to add on the subject of how you're taking care of your personnel and decontamination issues?
Well, first, if I could just comment on the discussion about the jail. In any infectious disease outbreak, any place where there's lots of people living in close contact together, whether that's a jail or a nursing home or assisted living facility or a dormitory, obviously is really a hotbed of concern in terms of controlling spread. And so in addition to the obvious moral and ethical concerns that I think Joe and RaShall identified as driving a lot of their decision making, which is outstanding, from a response perspective, any outbreak in a facility like that would put not only other people in the facility at risk, but the folks that work there, and it could potentially stress the EMS system and the hospital system unnecessarily. So, I certainly applaud a very proactive approach. That this really is a unique time where we're mixing public health, public safety, and broader community values in a very short, compressed time frame with very real consequences. And I'm very comfortable and confident that this decision-making process has been done very well. In terms of our process in the field, I would echo what Chief Brackney just said. We've changed how we do business in terms of how we approach every type of incident. Obviously, there are limitations. A couple of weeks ago, we had an apartment fire over off Prospect Avenue. There's only so much social distancing you can do during an active firefight in an occupied building. But in terms of our EMS response, we've adopted what we refer to as a scout model, where we minimize the number of firefighters and EMS providers that are actually inside a building or inside a room. They make an initial determination on the appropriate level of personal protective equipment and how many other providers and firefighters they're going to need to be able to safely serve that patient. And then also we're doing, in a similar way to what Chief Brackney mentioned, we're asking people if they can to come to the front door. Or when we go to a facility, we're asking the staff to bring the patient to the front door. That's not always possible, but we're trying to sort of meet people in the middle and manage that risk together with the community.
Hey, Brian, may I?
Absolutely. Go ahead, Joe.
So one of the things, I don't want to get too into the weeds on this, but Chief Justice Lemons, who's the Chief Justice of the Virginia Supreme Court, declared a judicial emergency, and he issued an extension. I think it's through Monday, April 26th, whatever that Monday is. And the judicial emergency was declared statewide, and it said basically court operations. I'm not as familiar with the civil aspect of the order, but criminal hearings were basically halted, but there were several exceptions, and the exceptions were basically emergency type hearings. And again, I want to always stress and be clear, this is with the cooperation and collaboration of our local judges, clerks, and defense bar and jail personnel. But we have set up, and there's a provision in the Code of Virginia, we have set up the capability to have, at the defendant's request, so it's something the defendant and their attorney are asking for, video court appearances if it falls into a category of an emergency hearing. And so I think Chief Baxter and Chief Brackney, and you can't repeat this too much about social distancing and minimizing contact. You can't repeat it enough. Every time someone from the jail needs to get into a car and be transported to court and walk in and have a hearing and then get back in the car and get driven back to the jail, and just the ripple effects of the interactions that happen, we don't want that. So there's a provision in the law that we've been utilizing since Monday, March 16th, where defendants are appearing via video at their request and at their defense attorney's request and with the judge's permission. And we're doing some substantive business related to reviewing their custodial status and working out plea agreements or reductions or releases or bond hearings. And so, again, we're also within the judicial system able to have hearings while adhering to that sort of social distancing concept and model that is so vital. And so we're able to do quite a bit and are continuing to have hearings via video. And so I think that's really helped us continue to conduct business and continue to target that population to prevent that hotspot at the jail developing, because again, that'll just impact so many different people beyond the offenders who were of course cared about.
Thank you, Joe. And speaking of state level orders, let's talk about the governor's stay-at-home order. He had two executive orders. One was number 53, that was on Monday, March 23rd, and then number 55 a week later, Monday, March 30th. The stay-at-home order, you were involved, Chief, in writing a letter with Chief Baxter to the governor asking for a more forceful wording of that first order. Tell us what your thinking was on that.
So our thoughts were that in a time of crises, in a time of a pandemic, when you have an unknown, people will respond to very clear directions. They need to understand what the cost would be of not adhering to an order. I liken it to giving advice in which the person then has the opportunity to decide whether they want to take your advice, or if you give them direction, much like you would as a supervisor or as a boss, where there isn't a lot of discretion in that response. We were looking at the bigger picture here, and I would still encourage and urge our governor to take stricter steps about what does this stay-at-home order actually mean, and to be very clear about the impact of not staying at home. When you hear the governor say things like, well, when you're out and about and want to stop and get a book because you want to read or do something leisurely at home, at this point in time, the opportunities for online reading, the opportunities for digital downloads, there are a lot of places that are providing resources now and very creative ways to engage. My thinking was, and still is now, that we need to do everything that we can to make sure that we protect our communities. And that includes the economic community. And that can still happen. If you can go buy a book in a store, then buy it online. If you can go and get some art and craft equipment, get it online. Any of those things that you can do to create a space for recovery, and for, as I continually write, we have a collective and ethical responsibility at this point for a co-production of our public health and our public safety. And we must take that seriously if we are ever going to recover in unprecedented times. And when it's unprecedented, as the Commonwealth's attorney said, where there is no playbook, then you need to give very clear directions to create a playbook. Otherwise, everyone is throwing the ball to everyone, and nothing is, and their ball's never advancing. Or in this case, what we're trying to do is stop the ball from advancing.
Yeah, and local government is often where things end up, right?
Absolutely.
Where the action has to be taken.
Absolutely.
How's your department approached these, gatherings when there are more than 10 people?
So we've put a lot of standards in place, and we've briefed our leadership on what our approach is going to be. Our approach is always going to be first educational, to tell people, to inform them of the dangers of violating Executive Order 55 at this point. 53 was the first one in which we made suggestions. 55 is a little bit more time-out-ish, so we will deal with that. But if you are violating the 10 or more gatherings, if it is a building that or a restaurant that is open and it's not for takeout, etc., the first thing what we're doing is through 911 calls, and we're averaging about 5 to 6 of those through the 911 system a day in which someone is in violation of the executive order. What happens then is that call is routed to our non-emergency number. The officer then takes down all of the information about the violation, and then we contact the business owner or the residents by the sourcing that we have to get their phone numbers, the names, etc. We then talk to them on the phone and tell them that this has been a recorded call and that we're going to report this violation to the Department of Health. Any of these subsequent ones where we either have to send an officer to that location or anything of that nature, we will do it safely. We will do those warnings via PA system where we can then maintain our distancing, that they are in violation of the executive order, that it is going to be documented, and then it's also going to be referred to the Commonwealth's Attorney's Office as well as to the Health Department. And if we have to enforce this order, I am sure, and I will punt this over to our Commonwealth's Attorney, that he will be very clear and supportive if we have to enforce this, including the misdemeanor violations. And I'm sure the Commonwealth's Attorney can speak to that a bit more robustly.
Okay, Joe, we're passing the ball over to you.
Yeah, so Chief Brackney shared her draft sort of model of how to deal with this situation, and I think she drafted it for the area. It was beyond the city of Charlottesville. And it actually got pushed out statewide to every other elected prosecutor. An individual that I work with reviewed it and said, I think we should use this as a model for the Commonwealth and how to handle walking through these gatherings. And so it was sort of a very well-received document and plan. So yeah, I guess let me be as clear as I can. Chief Brackney and I talk a couple times a week. If either of us have questions for the other, we're always on the phone and in very close contact. And the Charlottesville Police Department and Chief Brackney 100% have the support of our office, and any violations that are written will be prosecuted. And it's a Class 1 misdemeanor. You're looking at up to 12 months in jail and a $2,500 fine. And, you know, there's a common theme here with Chief Baxter and Chief Brackney. The decisions that people are making in this community have ripple effects and affect others. So don't be selfish. Listen to the guidance that you're being given by the professionals. Stay at home, socially distance, just be smart and thoughtful and responsible and respectful. And we will 100% have the backs of the Charlottesville Police Department for any of those citations that are issued. They will be prosecuted in court.
And Chief Brackney, you know, the governor's order asked Virginians to shelter in place except for essential travel.
That's right.
So typically that's going out and getting food, provisions, right?
Absolutely.
Which is okay. But have you had to enforce, you know, people, you know, out traveling? You know, is that something you run into or you've been asked about?
So yes, we're asked about it all the time, about what that looks like. So we are echoing the Virginia Department of Health as well as the CDC when they're saying that you should go out for your essentials. Go out for food, go out for prescriptions, go out for those, if you have a doctor's appointment in which they're no longer doing the telemed at this point, sometimes you do need to physically see your doctor and things of that nature. Please go out for those essentials. Please go out to get some exercise and fresh air. Stay at home does not mean self-isolation at this point. Get outside, do some things creatively outside as long as you're maintaining the 6-foot social distancing and you have crowds of 10 or more. We're asking you then to stay at home for everything else. We've now created a messaging for all of those persons in the community. Stay at home so we can come to work. Stay at home so that the people who may need to save your life are here and the ability to do that. So we do have lots of questions, and we are recording each of those ones so far. So we've not had to issue the citations, but we definitely have had to follow up with the individuals as well as those businesses that are suspected of violating Executive Order 55.
So at this point, there have been no misdemeanor citations.
No, not at this point. We have not had to issue any. So we do thank our communities for adhering to a lot of those. We would also ask that social media is important right now, that we not stir up anxiety and angst around these executive orders and tyranny. These orders are put in place to keep the public safety or the health and the welfare of the entire community. We hear lots of language about these are unconstitutional when they're calling us. And, you know, I'm not here to debate the constitutionality of any of this. What I am here to say is that we are trying to keep the public safe. Again, the segment is balancing our community health with our community safety.
Right. And clearly we're all in this together because more than 93% of the country right now is under some sort of stay-at-home order. So it's not like Charlottesville's being picked on that front.
Right. Yes. We're not unique in that front. Thank you.
Yeah. And I think we're starting to see the benefits of the social distancing and putting these measures into place. In New York, you know, they're starting to think that they're seeing the trends drop, which is positive. And as Chief Baxter said, our peak caseload may not come till later this month, and then we have to think about what it looks like on the other side. But we still have a lot of work to do, and we need the community to keep cooperating with everyone.
Right, and the structures that we're putting in place now, these are good structures that we can carry through, not only for this pandemic, but what does in another emergency come? It isn't going to be a matter of if, it's when. The next thing that we will all have to do as a community collectively to keep Charlottesville and the region safe.
And next we're going to go to Joe Platania because we have a question, Joe, which I'll read to you right now. It has to do with the courts. And the question is, if defendants aren't requesting video court appearances, what precautions are local courts taking, since usually in a courtroom you're sitting in close quarters to others? And sort of what guidance are the attorneys being given?
So great question. So any hearing where an individual is not incarcerated or they're out on bond, those are all being continued. And they're being continued by written notice to the defendants, and the clerks are doing and the judges are doing a tremendous job pushing those notices out. So those people just aren't even coming to court, nor are their defense attorneys, nor are witnesses or victims. And we're working with police officers that are witnesses and victims and making sure that no one's showing up to court. So all of those, which is the majority of what we're dealing with, those are all getting continued without any appearance. If a defendant is requesting to be brought over and be present, the judicial emergency order we're treating is we're not bringing you over. We're just going to move it and continue it if we can't do a video appearance. So what we're left with is if there's a defendant on video, there's a judge, a clerk, a court reporter, a defense attorney, a prosecutor, and perhaps a sheriff's deputy. So there's about 6 of us. Masks were being worn starting Monday in the General District Court. I'm guessing in Circuit Court next week we'll all have face coverings. We're all adhering to 6 feet apart. We're all very carefully hand sanitizing when we have to touch any sort of documents. So it's a very small number of people. We're not within 6 feet of each other, and it's really, we're just not really having court. And so again, the defendants on video is a way that we're not having them have to be transported back and forth. So I hope that answered the question.
Thank you. And that question was from Carrie Elwood, and hopefully we answered that. And Don Gathers is on the chat on the webinar right now, and he thanks both Chief Brackney and Joe Platania for all the information you're providing in this segment. So thanks, Don, for that feedback. Again, it's that easy to ask a question. You can type it in the chat, you can type it in the Q&A module, or you can raise your hand and we will bring you on live on the webinar. It's not too late to join the webinar. If you're watching through another channel right now, you can go to charlottesville.org/Zoom and sign up for this webinar and any future webinars that we do related to Cville360. This show is airing every Tuesday at 11 a.m. and every Thursday at 4 p.m. And we hope you'll join us and give us feedback about future shows. Chief, let's go to motorist and traffic stops. Something I worry about. What is the police department's policy for stopping a motorist during the pandemic?
So we're not going to give you every secret so that every person is out there speeding around and blowing through every stop sign.
Okay, you can tell me afterwards.
Okay.
Jeff Sandridge is going to write a question in, so careful what you say.
Yeah, I can see him. He's probably outside now in the hallway saying, "Don't tell him anything, Chief," as you see him on 250 right by McIntyre Park. But anyway, what we are doing is, much like everything else, serious traffic violations. We are still engaging with serious traffic violations, although we may have different protocols at this point in time. Versus taking your license, we'll ask you to hold it up, take pictures of it, and then go back to our vehicles to do the things that we need to do. We can issue the citations via mail now versus handing you a citation. Our officers have personal protective equipment. They have gloves. They have masks. As you know, I wore my mask down here on the way out. We are encouraging that. We have now, to decrease our contact when there might be a person that has to come into our vehicle or into our space, we immediately have to wipe down every one of our vehicles with the Clorox wipes, the handles, and things of that nature. What we are seeing is a reduction in motor vehicles out on the streets because there are so many stay-at-homes. People are teleworking, schools, the buses, and things. So we're a lot less traffic. But we are still enforcing those very serious violations now and pulling them over for those. For those less serious violations, if you get a citation in the mail, then you will realize that we still are enforcing the laws. We're just not coming into contact with you.
And this seems like an let's see, what's the right word? This wouldn't happen very often given the training of your staff. But if an officer approaches a vehicle and there's some evidence that they're coughing, that they may exhibit some of the signs of being sick, what should a motorist do?
So a motorist, what we are asking them to do is we may have the same questions of them, the pre-screening questions that the 911 is using. Our officers have those pre-screening questions as well. So that has been pushed out across. But we are also taking it very seriously, and I've been in conversations with the Commonwealth. If you believe that coughing on our officers or telling them you have COVID-19 or some way trying to transmit that, even as a hoax, we are taking it extremely seriously that you would be attempting to transmit a virus or to obstruct justice to get out of that, either that citation or that crime that you may have been engaged in or which the officer is stopping you for.
And for the person in the vehicle, if they're just concerned about other human contact, I mean, they were out going to get their groceries and they're trying to social distance, and then suddenly they're faced with the unfortunate consequence of being pulled over and an officer's walking up to their door. I mean, if they have concerns, is there something you would advise them to do?
So what I would also remind them, so the part of what our training is, we train to stay 6 feet away from people, including in traffic stops. There's the automatic distance between where you're sitting and where we are. But I'm sure our officers would be very comfortable with a healthy reminder that to remind them over their social distance, right? Our officers to have their mask on, or to say I would feel much more comfortable if we had this interaction with your mask, if you have your personal protective equipment. I would definitely make sure of that. We also want to understand, and this may be thrown back to Chief Baxter, who has a little bit more information than I would, we want to make sure that people understand the difference between a mask and a facial covering, and to what those abilities to help tamp down the transfer of this. Because we are now getting mixed messages about whether it can be aerosolized, regardless of whether there's been direct contact. So encouraging everyone to use their mask, and even reminders for our first responders, there would be no one who should be offended by it.
And before we go to Chief Baxter on that, Chief Brackney, the type of mask you wore this morning, was that the N95 type mask?
No, these are, I will pull it out. Look at this.
All right.
This is the type of mask that I wore this morning. These are the common surgical masks that have the elastic that would go behind. We would ask that, particularly when you have our public safety personnel, these are the types of masks that you will see them in. It may be a different color. The N95s are much more robust mask than the typical surgical mask that you will see us in. But we are doing that again so that we don't contribute, as well as we're not recipients, because we are out in the community at all times.
Yep. Chief Baxter, is there anything you would like to add on this topic?
Sure. So per recent CDC changes in CDC guidelines that came down through BDH as well, they're now recommending that anybody wear a cloth face covering or face mask in a public setting, particularly where social distancing cannot be maintained. And the primary purpose of the cloth mask, or really any mask on a patient, is to reduce their chance of exposing other people, of introducing particulate or aerosolized virus into their environment. So in fact, one of the first steps that our providers take when they contact a patient is to put a surgical mask, the one Chief Brackney has there, on the patient first. And that's going to begin to dramatically reduce the risk to anybody that's around them. And I can't overemphasize enough how important it is for the general public to begin to adhere to that CDC guideline about when they're out in public, which again should be for limited reasons, they should wear a cloth face covering. And there are, in the last 48 hours, multiple different ways communicated on how to make one or where to buy one. I've got mine here, which of course has a fire apparatus on it. I'm out and about. It's critically important in this limited PPE environment to retain not just surgical masks, but in particular the N95 series and N100s for healthcare providers, EMS providers, law enforcement that are providing direct close-up care and services. Those masks are different in that they protect the wearer in a way that a cloth mask doesn't. So we sort of have two things going on at the same time, trying to reduce exposure to other people around you through the use of a cloth mask, and then for those that in the course of their duties are required to be in close contact, everything from in an intensive care unit all the way down to in somebody's home during an EMS incident, or with a police officer or a sheriff's deputy, where they need that type of mask. So one other thing to note about the mask guidance in the last 48 hours, I hope people understand at this point that we've been saying a number of times there's no playbook. That's true of the science here too, that's driving a lot of these guidelines. So the flexibility that we're asking of our own workforce and of ourselves and of our community, we understand that. And by and large, we're seeing incredible degree of buy-in and compliance from the public. It really is remarkable. When you go out on the street and you see nobody, that's a good sign, right? I know it's difficult economically and for other social reasons, but the more deeply we take those behaviors into our own lives, the quicker we will get through this. So please, 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 the single most important thing people can do is that social distancing. And I must add to that, and we've been talking about masks a lot very appropriately, but the other thing people need to keep doing is washing their hands, washing their hands, washing their hands. That's critically important.
Thank you, Chief. Chief Brackney, before we go, I wonder if you could just talk about, we obviously have existing race and class inequities in the community, and what does the pandemic do to this existing climate? And any thoughts on race and equity?
So yes, what does it do to the existing climate? So there's already a concern about either over-policing or under-policing communities. Particularly when it comes to our low wealth, our minority communities, and those communities that don't necessarily have access to government resources and even power. So there is a concern that those persons in minority communities may not get policing services that individuals believe that they need or should get, because law enforcement is fearful of going in when you add a pandemic to that. This community particularly has a lot of racial issues. And then I think also it's not even policing economically. Where are the resources going to help which groups? And you think about the donations and who's been able to mobilize around donations, who's been able to mobilize and the challenges for our unsheltered community or our homeless populations, right? These could exasperate those relationships. So I am being very intentional with my conversations with our officers that these are also groups who are probably experiencing economic devastation right now, may not have health care. So the likelihood that by the time they seek health care, they're severely ill or to seek assistance. All of these things add home conditions. The fact that you may have food insecurity at this point in time. How am I going to feed my families when I may have been relying on the school systems to help me do that? What does transportation look like to get to the places where the school bus normally took my child to school? One of the donation centers may not have that. I may not have that availability to get there. CAT is running on a very different schedule with no more than 10 individuals, and we're cutting back on those things. This could all really cause an additional wedge if we are not thoughtful, intentional, and we see the cost. I make notes all the time that right now this is more than laws and ordinances. This is lives. And we need to be very thoughtful and intentional about how we serve those communities who typically look at us with good reason through an askance or a side view.
Chief Brackney, thank you so much for your work in the community and for the work of your officers and staff. We really appreciate it.
Thank you. Can we leave you with our non-emergency numbers so that we don't tax the 911 system?
Share that.
Absolutely. If you have any questions about the concerns about the executive orders or how those may be enforced or just a generic question, we've set up our lines at 434-970-3280. That's our non-emergency numbers that we operate typically, and someone will answer that call 24 hours a day.
Thank you.
Thank you.
And we'll put up on the screen right now the community resource line. This is a place that the community members can call if they need assistance. That number is 434-234-4490. We'd encourage you to tap into that resource. And we're going to finish the show today. Our next show is on Thursday, April 9th at 4 p.m. We're going to pivot away from the topics we've been talking about today and talk about how the city is handling development and building activity in the midst of this pandemic. We'll have a 5-person panel of city staff that include Missy Creasy, our Deputy Director of Planning, Lisa Robertson, Deputy City Attorney, Tom Elliott, a code official, Jack Dawson, City Engineer, and Chris Engel, our Director of Economic Development. We hope you'll tune in on Thursday at 4 p.m. Again, please contact me with feedback about Cville360 and ideas you have for future shows and topics. Thank you for watching, and please stay healthy.